Can we live without our brain? Well, actual question is, can we live with some or half of our brain removed? We are going to find out in this video. Subscribe to learn more amazing lesser-known facts about our body. It is possible for an individual to live with only half of their brain, although it is a highly complex and specialized procedure. The remaining half of the brain can compensate for the loss of function caused by the removal of the affected half. Hello and welcome to our video on hemispherectomy. This is a highly specialized and complex surgical procedure that involves the removal of one half of the brain. In this video, we'll be discussing the history, purpose, process, and recovery of hemispherectomy. We'll also touch on the conditions that may require this procedure, as well as the decision-making process behind it. So whether you're a medical professional, a patient, or a loved one of someone who may be considering this procedure, this video is for you. A hemispherectomy is a surgical procedure that involves the removal of one half of the brain. This procedure is usually performed in children who have suffered from severe neurological disorders such as cerebral palsy, Rasmussen's encephalitis, or Sturge-Weber syndrome. It is considered to be highly complex and risky, and is typically only performed as a last resort after other treatments have failed. The decision is made on a case-by-case basis, and is based on the specific needs of the patient and the severity of the disorder. There are two different types of hemispherectomy procedures: functional hemispherectomy, which involves the removal of the affected half of the brain, and anatomical hemispherectomy, which involves disconnecting the affected half of the brain. In rare cases, some patients who have undergone hemispherectomy have been able to regain some of the abilities that were lost due to the procedure, through a phenomenon known as neuroplasticity. If you want to know more about neuroplasticity, comment down below. Overall, the outcome of the procedure can vary depending on the patient's age, the location and extent of the brain damage, and the specific disorder that is being treated. It is important for patients and their families to carefully consider all options and weigh the potential benefits and risks before making a decision about undergoing this procedure.